AI diagnosed patients better than doctors. Should we be worried? Should I be worried about my job? You'd think so. You would think that if the question is like, what diagnosis does a certain patient have? Both doctors and AI would be getting it right almost all of the time. Honestly, that's what I thought too. And that's exactly why this recent paper is so interesting. The numbers are much lower than most people expect, lower than I expected. And it tells us something important about medicine itself. So you have a patient, walks into the ER with chest pain, shortness of breath, abdominal pain, dizziness, confusion. Everyone assumes the difficult part is the treatment, but it's not. The difficult part is finding out what's actually happening in the first place. That's a big reason why this paper caught my attention. It was published in the journal Science on April 30th, 2026, and the title is this: Performance of a Large Language Model on the Reasoning Tasks of a Physician. The researchers wanted to know whether an advanced large language model, specifically OpenAI's O1 reasoning model, could perform the kind of clinical reasoning physicians do every day, especially in emergency medicine. So this wasn't like polished board exam questions. This wasn't like a beautiful textbook case. It wasn't a rare scenario. This was real clinical reasoning: messy charts, incomplete histories, fragmented information. Real ER cases where decisions have to be made often very quickly and often before the full picture is clear. And here's the part that surprised even me. In one of the ER triage experiments, AI correctly identified the diagnosis in about 67% of cases. Compare that to physicians who were around 50 to 55%. Physicians were right only 50 to 55% of the time. When AI was given more detailed information, its accuracy rose to about 82%, still slightly ahead of human physicians. Now let's stop there, because those numbers, like I was saying, they're not what most people expect. Most people hear that and think, wait, only 50 to 55% for physicians? Shouldn't doctors be right nearly all the time? And honestly, if you're not in medicine, that reaction really does make complete sense. But that reaction also reveals how people imagine diagnoses. People think making a diagnosis is like solving a crossword puzzle where all the clues are already there and we just kind of have to pretty put it together. It's not all the time. It's more like walking into the middle of a movie halfway through and trying to predict the ending. The patient doesn't arrive with a big label saying what their diagnosis is attached to them. They arrive with symptoms, they arrive with pain. They're often scared. They give you just fragments of a story, so you're kind of trying to piece together things just from parts. Sometimes they don't even remember what happened. Sometimes they minimize the symptoms and they're super stoic, and we just have to kind of press them to get more information. And then sometimes they're just so sick that they can't really explain clearly what's going on to them. And oftentimes I feel like the symptoms point in all these different directions at once towards different diagnoses, so it gets complicated. That's medicine. That's what I see all the time, and I'm not even an ER doc. So diagnosing somebody, it's not like a checklist. It's not just labs and imaging and clicking boxes in an electronic chart like Epic. Sometimes the diagnosis is really made by not only pausing and listening to the patient, but actually having advanced reasoning skills and experience. Sometimes it's in the patient saying, I know my body and something's really wrong and help, I don't know what it is, but something is off. I'm Irmina Van Dyken, MD, from Out of the Doldrums, and this paper opens a much bigger conversation than whether AI is smarter than doctors. It actually asks a much broader question, like, what happens in the future? What happens when AI becomes better at pattern recognition, but humans are still responsible for the care? Because I feel like that's where medicine is headed. I don't feel like it's going to be all AI and no doctors, or all doctors and no AI. I think it's going to be a hybrid of this. I think where we get into trouble is where we frame AI versus doctors. That's the wrong frame. Doctors are human. They are human. We get tired. We get interrupted. We get biased just by the way that patients present themselves. We get anchored to the first plausible diagnosis that we put in our mind, and we think that that's what the right diagnosis is. As physicians, we are vulnerable, especially in a busy emergency setting. The thing about AI, it doesn't get tired, doesn't get distracted. It can hold a broad differential diagnosis and it can say, yeah, maybe it's pneumonia, but did you also consider something like a pulmonary embolism or aortic dissection or sepsis? All these things that are rare and could be dangerous, that's useful. So to me, AI doesn't really replace judgment, but it protects against tunnel vision that we get a lot of times as physicians. So when I think about it, honestly, I think this could save lives. On the flip side, I also think that this is where people need to slow down. This study is interesting because it tested text-based reasoning. It didn't test bedside medicine. It didn't test how well we examine our patients. It didn't test the entire human encounter with all of the draws and the stories. The AI, it read what was in the chart. It processed the text, processed the notes, didn't stand at the bedside and look at the patient, didn't notice the gray skin color, didn't notice the subtle change in breathing. It didn't feel the abdomen. It didn't see the patient that says they're fine when they're clearly looking like they're about to crash. You know, we've all seen those. So, yeah, I mean, if you practice medicine long enough, you know that those feelings and those intuitions, they matter. Sometimes you can't explain it yet, but you just pick up on it. You just know. I don't know. Can AI replace that? And the part of me really that wants to defend that and thinks that our intuition is stronger than everything didn't pan out in this study. That's the part that surprises me. An AI model can give you a diagnosis, but it can also recommend unnecessary testing that could expose a patient to harm. So a physician has to balance accuracy with safety, timing, judgment, and potential consequences. And medicine's not a multiple choice exam. It's a responsibility. It's a person. And that's something else that people forget. Like, patients don't come to us just for information or for a diagnosis. It's true, they can do that with GPT. But they come to us for trust. They come to us when they're pretty vulnerable. They come needing somebody to hear them, to hear their story. It's like nobody wants to hear in the emergency room while they're terrified and feeling really sick, "Don't worry, the algorithm thinks you're fine." No, they want a person. They want someone accountable, someone who can explain the uncertainty, what's going on with them, somebody who's in the room when things get hard. AI definitely cannot do that, at least not yet in any meaningful human sense. So when people ask the question, can AI replace doctors? I think that's actually the wrong question. A better question is, can AI help doctors miss fewer things? That's a much more important conversation. Because the future, it really shouldn't be AI versus physicians. I feel like it should be AI plus physicians versus misdiagnoses. That's the real opportunity. There's one other thing that I do want to talk about when it comes to AI in medicine, and that's confidence. AI can sound really certain at times, even when it's wrong. It hallucinates. And what I tend to see is people mistake that confidence with competence. They hear GPT give them a really beautiful, polished, pretty packaged answer and a red ribbon, and they assume that it's accurate. But I feel like that's really dangerous in medicine. So yeah, there's a risk that AI can make mistakes, it can hallucinate, and the risk is that humans stop thinking critically because the AI is so convincing. It's delivered it to you just so perfectly. And that is a worry. It's unacceptable, really. So clinical judgment can't be outsourced. It can be supported, but it can never be like fully given up or surrendered. Like that line matters to me, especially now. So we need rigorous trials. We need more of these trials, real world testing, accountability, transparency, and of course, constant monitoring by human brains, not just like benchmark tests. So even the authors of this paper were very clear about that. They were saying that like strong performance on a defined task does not automatically mean safe deployment in patient care. I couldn't agree more. So the future of medicine should not become less human because AI gets better and better. It should become more human. The machine can help us with memory, with pattern recognition, with diagnostic possibilities. And then maybe the physician has more space to do the work that only humans can do. like be at the bedside, be present, use judgment, allow for trust. I mean, that's really, at the end of the day, the medicine that the patient remembers. They remember the doctor that held their hand when they were scared, not the diagnosis code or what the algorithm says. So I feel like that, the human aspect of medicine, is something really worth protecting. So yeah, I want to hear from you all. I'm curious. Would you feel reassured if your doctor used AI as a second opinion? Or would you feel threatened? Or would that make you feel uncomfortable? And this is an important question and something to think about, because this conversation, it's no longer theoretical. It's already here. And how we handle it and what we protect and what we surrender in regards to AI will shape the future of every patient who walks into a hospital. So yeah, let me know in the comments below what you think, and cherish your health always, and aloha. A new study published in Science found that AI was better than physicians at diagnosing certain emergency room cases. That headline is getting attention fast, and honestly, it should. But before we jump to AI is replacing doctors, we need to talk about what the study actually showed and what it didn't. In this video, I break down the paper, Performance of a Large Language Model on the Reasoning Tasks of a Physician, published April 30th, 2026, and why those results matter more than most people realize. These numbers surprise me too. In some emergency department cases, physicians got the diagnosis right far less often than most people would expect, and the AI did perform better. That doesn't mean doctors are failing per se. It means the diagnosis and making a diagnosis is incredibly hard, especially when you need to make that diagnosis early, or when symptoms are vague or information is incomplete. And a potentially life-threatening diagnosis can look almost exactly the same as a harmless one. So yeah, I mean, medicine, it's not just pattern recognition. Sometimes a diagnosis is the way a patient walks in the room. Sometimes it's in that gut feeling that something's wrong before the labs even confirm it. That part still matters. AI may become one of the most powerful tools we have for reducing missed diagnoses, but it cannot replace judgment, trust, responsibility, or human presence at the bedside. So when you look at a big picture, like, the future, in my opinion, should not be AI versus doctors. It should be AI plus doctors versus a missed diagnosis. Would you feel reassured if your doctor used AI as a second opinion? Or would that make you feel uncomfortable? Or would it feel threatening to you? Let me know in the comments. I'm curious to know what you think. Cherish your health always, and aloha.